In a cramped laboratory in London during the early 20th century, a revolutionary discovery was about to unfold. A discovery that would change the course of medicine and save countless lives. This is the story of Alexander Fleming, a man whose curiosity and serendipity led to the birth of antibiotics and transformed the battle against infectious diseases. Alexander Fleming was born in 1881 in Lochfield, Scotland, into a family of farmers. From a young age, he displayed an inquisitive nature. After attending a local school, he went on to study medicine at St. Mary's Hospital Medical School in London. Despite facing financial struggles, Fleming persevered and graduated in 1906. His early career was marked by a commitment to understanding the microscopic world, driven by the hope of finding cures for diseases that plagued humanity. Fleming's early experiences as a soldier during World War I deeply impacted his view of medicine. He witnessed firsthand the horrors of war and the devastating effects of infections on wounded soldiers. The inadequacy of treatments at the time frustrated him. He often thought that there had to be a better way to combat these deadly infections. In 1928, Fleming returned to St. Mary's Hospital after a vacation. As he entered his laboratory, he noticed something unusual. A petri dish containing Staphylococcus bacteria had been left uncovered. To his surprise, he observed that a mold had contaminated the dish. The mold, later identified as Penicillium notatum, was inhibiting the growth of the Staphylococcus bacteria. Fleming was intrigued. He carefully analyzed the mold and found that it produced a substance that killed bacteria. He dubbed this substance penicillin. This accidental encounter was the beginning of a scientific journey that would change medicine forever. However, Fleming faced skepticism from his peers. While he published his findings in 1929, the scientific community did not immediately recognize the significance of penicillin. Fleming continued his research, but it remained a curiosity rather than a medical breakthrough. It wasn't until the late 1930s and early 1940s that the potential of penicillin began to gain traction, driven by the urgency of World War II. Scientists around the world recognized that infections were a leading cause of death among soldiers, and there was a desperate need for effective treatments. Howard Florey and Ernst Boris Chain, researchers at the University of Oxford, took up the challenge of isolating and mass-producing penicillin. They built on Fleming's initial discovery, conducting experiments to determine how penicillin could be used therapeutically. Their work involved refining the extraction process and testing the drug on infected mice. The results were astonishing. The mice treated with penicillin survived, while untreated ones succumbed to infection. Despite their progress, Florey and Chain faced a significant hurdle: how to produce penicillin in large quantities. They collaborated with pharmaceutical companies and enlisted the help of American industry during World War II. With the support of the US government and extensive resources, the production of penicillin surged. By 1943, penicillin was being used extensively in hospitals. Its ability to treat bacterial infections dramatically reduced mortality rates. Patients suffering from pneumonia, syphilis, and infected wounds found new hope as penicillin became a standard treatment. One particularly poignant story involved a soldier named Private John R. McFarland, who was critically wounded during the D-Day invasion of Normandy. In the aftermath of the battle, he developed a severe infection. Thanks to the timely administration of penicillin, he recovered and lived to tell his story, a testament to the drug's life-saving properties. As the war progressed, penicillin became widely available, saving countless lives on both sides of the conflict. It transformed surgery, making previously risky operations much safer. The medical community hailed it as a miracle drug, and Fleming, Florey and Chain were celebrated for their contributions to this monumental breakthrough. The Nobel Prize and Legacy. In 1945, Fleming, Florey and Chain were jointly awarded the Nobel Prize in Physiology or Medicine for their discovery and development of penicillin. Fleming's acceptance speech reflected his humble nature. He emphasized that the collaboration and hard work of many individuals were crucial to the success of penicillin. The impact of penicillin extended far beyond its immediate medical applications. It sparked a revolution in antibiotic research and development, leading to the discovery of numerous other antibiotics. This new era of medicine brought hope for treating infections that had previously been deemed untreatable. The ethical dilemma. However, with the success of penicillin came new challenges. As antibiotics became widely prescribed, the overuse and misuse of these drugs led to a troubling phenomenon: antibiotic resistance. Bacteria began evolving to withstand the effects of antibiotics, rendering some treatments ineffective. Fleming himself warned of this danger. In a 1945 speech, he cautioned against the indiscriminate use of antibiotics, urging for caution and responsibility. His prophetic words became a stark reminder that every medical advancement carries both benefits and risks. The modern era of antibiotics. Today, antibiotics remain a cornerstone of modern medicine, but the rise of antibiotic-resistant bacteria poses a significant threat to public health. Infections that were once easily treatable are becoming increasingly difficult to manage, leading to longer hospital stays, higher medical costs, and increased mortality. Scientists are racing against time to find new solutions. Research into alternative treatments, such as bacteriophages, which are viruses that target bacteria, is gaining momentum. Additionally, efforts to develop new antibiotics are underway, alongside campaigns to promote responsible antibiotic use. Conclusion: a legacy of discovery. The story of penicillin is not just about a groundbreaking discovery. It's a narrative that intertwines curiosity, collaboration, and the quest for knowledge. Alexander Fleming's serendipitous encounter with mold set off a chain reaction that reshaped medicine, offering hope and healing to millions. As we confront the challenges of antibiotic resistance, the legacy of penicillin serves as a reminder of the need for continued innovation and ethical responsibility in science. The journey of antibiotics is ongoing, and the lessons learned from the past will guide us in navigating the complexities of modern medicine. In the end, Fleming's legacy is not merely one of discovery. It is a testament to the human spirit's resilience and the relentless pursuit of understanding the world around us.